So, what is Guraja sir's approach to treat Prameha and Madhumeha in general, including how to understand Nidan and all?
See, very simple. If a patient comes to me, many a time it so happens, particularly in case of Prameha and Madhumeha and these type of disorders, patient approaches for a non-healing skin disease, the one which is not suppressing. He is not a diabetic. He doesn't know that he has a diabetes or something like Prameha or Madhumeha. His skin condition is not suppressing. So then, out of doubt, when we go for, because when the skin is condition is not going to yield or getting results, then out of curiosity, when we check it up, then we'll find many a times find that that person is suffering from Madhumeha or Prameha. This is one point. Second thing, there are some certain times patient complains with pains, vague bodily pains. Then also we suspect. And of course, when we take up the family history which is supporting, then we also suspect. These are the one areas we think of it. Second thing, for a first time, if a patient is getting diagnosed that there is a high blood sugar levels, then we need to elaborately check it out because it's a laboratory tool which is supporting to our diagnosis. We need to understand whether it is already in the form of Madhumeha or it is only in the form of Prameha. See, very clearly, Ayurveda speaks about what is Madhumeha and what is Prameha. There are 20 varieties of Prameha which has been explained. Out of that, 10 are Kafaja Prameha, they are curable. So we can keep these 10 varieties under the category of pre-diabetic of modern. Second thing, there are 6 varieties of Pittaja, they are Yapya, and there are 4 Vataja, they are totally Asadhya or they are permanent. So once this thing is understood, then we need to understand, we need to go for checking the sugars in urine. That is very, very important from the point of view of what Ayurveda speaks about. Ayurveda says that something which is required to the body is going through the urine is considered as prameha or madhumeha later on. Any prameha, if it is untreated for a long time, then it is converted into madhumeha at the last. So we need to understand these concepts very clearly. When a patient comes to us, we need to check it up all the grounds of Ayurveda part of it. Is a sedentary lifestyle, consumption of rich carbohydrates, sweets, or even dadi or dugda, or consumption of milk and milk products, many other things. Then is lifestyle, everything we can make a note of it. Then after complete this protocol, then we can just check it up whether he has a sugar in urine. If sugar is present in urine, means this is not pre-diabetic, it is already in a diabetic stage. It is Madhumeha. So repeated occasions, maybe in a gap of 3 days, 5 days, or 1 week gap, you can repeat the process of identification. Once you try to analyze the value of sugar in urine, on 3 successive occasions, if you don't find any sugar in the urine, then you can simply, there is a rise in the blood sugar levels, but there is no urine sugar, then it is very clearly it is a pre-diabetic stage. It can be reversed. The only thing is, once there is already a sugar out in the urine and it is in a large quantities, even protein is also there, triple plus, double plus, then it is very difficult. The patient has reached the age, in a stage which is crossed beyond the pre-diabetic stage, and it is a clear-cut pre-diabetic or Madhumeha. So in that condition, accordingly, we need to select the drugs for the purposes. Of course, when there is type 1 diabetes where the person has become such a high level of blood sugar and even the urine sugar, and even with the medication it is not coming down, then he requires insulin. So that has to be, that is almost pushing the patient towards the very typical type of Madhumeha, which is very clearly Ayurveda says, which is Asadhya. So we need to understand these concepts, identify the sugar in urine. If it is there on repeated occasion, then it is Madhumeha. If it is not there in urine, it's only present in the blood, then it is a pre-diabetic stage. The things can be reversed. So this is the concept we need to keep in mind and practice accordingly.